Hi, let's talk about H.R. 1628, the American Health Care Act, or the GOP's Repeal and Replace Obamacare Healthcare Bill. Are pre-existing conditions covered? Yes, they are. They super are. The question is not about whether they're covered, it's about how much it costs to be covered. And even then, it's a little bit tricky. I'll explain. There is a section in here that says unequivocally that health insurance companies are not allowed to charge higher premiums to people with pre-existing conditions than they're charging to people who are healthy. So if your neighbor is paying $200 a month for the silver plan, you will also pay $200 a month for the silver plan. You're not going to be denied because of a pre-existing condition because they like your money, and 131 million Americans have pre-existing conditions. They like their money too. So are pre-existing conditions covered? They very much are. And they're even obligated to be the same price as everybody else's health insurance. Unless you live in a super poor state who has a huge amount of people who have health problems, pre-existing conditions, low incomes, and very few people who are healthy and want insurance. There is a waiver program. You have to apply for a waiver and be granted a waiver because your state has an exceptional situation. That doesn't mean that every state in the union is going to be granted a waiver. In fact, that's not realistic. And anyone who's saying that is not considering the fact that the fund is only $8 billion, and that's why there's a waiver system and not a free-for-all system. Most states that apply are probably not going to be granted that waiver. You have to have a pretty good case that health insurance markets in your state are truly at risk of leaving your state. And that can absolutely happen. Think about it. Risk aversion is a business practice that keeps your business going. We can all say all we want about how much health insurance executives get, and we will talk about that. But if they are going to do business in your state, they're going to try and minimize risk. And if they can't minimize risk, if they have nothing but risk, they're leaving. And you can't have a state without health insurance markets. You can't have it. What do? The states that are probably going to be granted that waiver are the states where truly and really health insurance companies would have to get out because they couldn't do business there. And that's likely poor southern states because that's their situation population-wise. If you have a pre-existing condition in one of those states, the waiver will allow the health insurance companies to charge you a higher premium than a healthy person. That's an exception that your state will be granted. To offset that extra cost, let's say your cost goes from $200 a month to $400 a month because of a pre-existing condition. That sucks. There's an $8 billion treasury fund set up, and that $8 billion for sure could not cover the difference of cost for all 131 million Americans that have pre-existing conditions. But that's not what it's for. It's for residents in states who have been granted that special exceptional waiver, which isn't going to be every single state. It's likely going to be 6 or 7 states, and that's a really vague estimate. I'm not positive. Don't quote me on that. The fact is that if your state is granted the waiver, they will have access to this $8 billion treasury fund, and it will be used to offset the cost that you are paying extra. So you go back to paying $200. I don't know if I agree with the way that the GOP is protecting poorer states, but that is why they're doing it, and it's real. So it's pretty silly to say that pre-existing conditions are not covered under this bill. Not true. It's also pretty silly to say that that waiver might as well not exist because everybody's going to get to dig into that $8 billion. When I see video clips of members of the Republican Party celebrating the passage of this bill with a caption that says that they're celebrating taking money from poor people, I know you didn't read the bill. I'm sorry. A lot of congressmen didn't read the bill. That's very disappointing, obviously, but that's why I feel like I have to make this video. I took some notes on the pros and the cons of this bill, and for the record, I don't like this bill, and I wouldn't vote yes on it if I were in Congress. But I want it to be clearly and obviously stated why it says the things it does, why it does the things it does, and how much money it would save if it were passed. I also need to say it is super unlikely, almost impossible, for the bill to pass the Senate in its current form. It passed the House, which is only step 1 of 3. The president's going to sign whatever they give him. So he's out of this question. But really, the House gave a rough version of this bill that just slid by to the Senate. The Senate is going to change every part of it, and we need to be aware while that's happening. But whatever the Republicans passed 2 days ago is not the reality of our legal system right now. It is step 1 of 3. Let me go get my notebook. Hold on. Unfortunately, the pre-existing condition myth is being thrown around as the #1 most important thing about this bill in its current form, and that's so off base it's ridiculous. What we should be talking about is the changes to Medicaid. Medicaid is, of course, the welfare version of health insurance, and there are some major changes in this bill, changes to the Social Security bill, and here are just some of them that really bother me. #1, the elimination of the requirement for state-run Medicaid programs to provide essential health benefits. Maybe because those essential health benefits were too over the top and unnecessary, right? Well, let me read what they are to you and you can decide.
Ambulances, emergency room services, hospitalization in general, maternity and newborn care, mental health and substance abuse services, prescription services, rehabilitation services, laboratory services, preventative care, and pediatric care.
Did I leave anything out? Can you think of a single essential thing that wasn't included in this list? That is no longer a requirement for a state-run Medicaid program. So I guess don't live in a shitty state is what this bill is teaching us. When you give states their states' rights, you have to be pretty picky about which state you live in. Because if they don't reflect what you feel is a human right, they're not going to give it to you. That's what states' rights can sometimes lead to. The outcome is that the above services may still be a part of states' Medicaid programs. I bet most of them will, but they don't have to anymore. There's no federal law requiring it. There are probably state laws requiring it, by the way. Every state has its own set of laws about Medicaid, so those are probably involved in there too. But basically what the GOP is saying is, let's give states the right to decide what essential healthcare services mean. I don't know if I like that. The eligibility limit for Medicaid under the Affordable Care Act, Obamacare, was 133% of the poverty line. Now that meant that if you made $45,000, which is the poverty line, that's the poverty line, 133% of the poverty line is $59,850. So that's significantly higher than $45,000. That's almost $60,000. You're beyond the poverty line at that point. And that is the eligibility requirement under current law with the Affordable Care Act. Obamacare made it so that you can be a third above the poverty line and still be treated as if you were under the poverty line. This bill takes that back to 100%. And about the poverty line, you may be like me and think that I thought that the poverty line was a nonsense figure, probably put in place by people with biases, or it's old information, or it doesn't respect inflation. I was wrong about all of that. The poverty line is set consistently by the Census Office, and they do it in a really effective way that totally considers inflation. So I was wrong. A quick Google search set me straight on that. The poverty line is there for a reason, and I do feel like when Obamacare set it to 133% of the poverty line to qualify for Medicaid, they were saying they don't trust the poverty line and what it's there for. But it's there for a reason, and so you can make your own decision on that. Also, those who lost funding under the Affordable Care Act for not joining that open market system will no longer be losing money. That's an important thing that they put in here. Oh, there's a part that says that if you actually do qualify for Medicaid in your state, they have to check up on you every 6 months and make sure you still qualify. That's new. That didn't exist before. There is a separate fund in this bill called the Patient and State Stability Fund that provides funding to states all the way through the year 2025, 2026, that provides financial services to people with pre-existing conditions that need to enroll in health insurance. So right from the get-go, they help you find the money to get the insurance coverage. That's in there too. So again, this argument that pre-existing conditions are just no longer covered, or that you can somehow be denied again for having a pre-existing condition, it's gone. It doesn't exist. That's not reality. The Congressional Budget Office did review a prior version of this bill at the end of March, and they concluded that it would save about $350 billion over 10 years, which is a big cost savings. I don't know what the CBO report would say for this version because we didn't get it back yet. Oh well, the House doesn't really care anymore about the CBO. You can't count on them too. That's why we have Senate, the wise old owls. So the bill sets a spending cap. We were just talking about states' rights. Well, now there is a spending cap on states for assistance expenditures for the elderly, the blind and disabled, for children, adults who just got Medicaid, and everybody else. So I don't know why we got all itemized. We were just going to finish with everybody. If a state exceeds the spending cap in a fiscal year, they will be hit with some reduced federal funding for Medicaid. So pretty crazy, right? If you spend too much money on helping the blind people, maybe you have a lot of blind people in your state or elderly people or whatever, then they will punish you by taking away some of your Medicaid funding. Hate that part. I get that you have to get your savings somewhere. That's a shitty place to get your savings. Thing about women's rights and abortions you keep hearing is that nothing changed. Abortions are still not covered under federal law because they never have been, and it's illegal for them to be, has been for a long time, unless there is a case of rape, incest, or what's the other one? Health of the mother. That's not new. It sounds ugly when you hear it out loud, right? But it is what it is. And that's the only thing that this says about women's rights to health care and abortion, et cetera, that they're still not going to be funded by tax dollars, and that they're still allowed in certain cases. Always have been. That's all. Obviously, it eliminates the individual mandate for insurance coverage. You don't have to have insurance coverage anymore. What does that mean? It means a lot of healthy people aren't going to buy insurance, and they're going to put the at-risk people, the people who have pre-existing conditions, in a weird place. And it might result in that waiver we talked about earlier being granted. So if you don't want that to happen, I suggest having some kind of basic coverage, even if you're a healthy young person. Doing our share for a stupid required market to stay alive. There is a tax credit in this bill beginning in 2020 for taxpayers who buy health insurance who aren't eligible for other workplace, for example, sources of coverage. There is a requirement to increase the premiums on individuals who were not covered for 62 days or more the previous year. And that's individuals who buy their own insurance, whether they're self-employed or they just don't want to be on their workplace's insurance program. If they were uninsured for over 62 days the previous year, it requires them to have their premiums increased. So I guess the individual mandate is bad, but that mandate is okay. They'll punish you for the past. Kind of dumb and really confuses you about what their message really is. I wasn't a fan of the individual mandate in the Obamacare situation either, because it really seemed like, hey, we have 1,000 things wrong with our health insurance process. We fixed 3 of them, and now you have to buy it. That was dumb, and this is also dumb. If you're married, you have to file jointly to get any of these benefits. That's a thing that's in there. It also allows health savings accounts, which are often given in the form of those debit cards that your health insurance company has been giving you. You can now use those for over-the-counter medicine. You can use those to buy ibuprofen or Benadryl, over-the-counter, whatever you want. You can use HSA for lots of non-prescription things, non-doctor things, which I think is pretty neat because I've always wanted to use that card for medical things without having to pay for a doctor's appointment or a prescription. That's kind of nice. I like that part. And again, those HSA benefits only apply to married couples if they file jointly, so do it. That might change. The tanning tax is repealed. You remember when Obama put a 10% tanning tax on indoor tanning? That's gone. That, I guess, counts as preventative. A few fees for pharmaceutical companies that existed for importing and market share fees, those are gone. And also, hate this one, hate it so much, there is no longer a cap on how much executive payment an insurance company can claim as a deductible on their taxes. So they can get like all 45 million of their income for the year tax-free. Why? I think we both know why. There's only one legislative rider in this bill, and it is this, the repeal of the net investment income tax. It repeals the 3.8% tax on the net investment income of individuals, estates, and trusts with incomes above specified amounts. Also, states that did not participate in Medicaid expansion, just like the ones who didn't participate in the marketplace, were given less federal funding. They now won't be. That includes the hospitals that didn't engage in Medicaid expansion. They'll be given the same as everybody else now. I think that's it. If I forgot anything, let me know. If you want to rip my head off because you super disagree with everything I said, that sucks. But maybe you should be the one staying up all night to read this stupid, long, annoying bill. A lot of congresspeople came out and admitted they had their staffers, I'm talking like interns, read their bill for them. And all those staffers know is the GOP gave us this bill. You're a member of the GOP. So I'll just tell you what it says so you can vote yes and tell people that you know what it says. But a lot of people are coming out and just admitting, I didn't read the bill, man. It's really long. I didn't have time. I had my staffers read it. That's why we have staffers. We're so busy. We're always traveling, you know? We have to do these talks, these town hall meetings. Yeah, I feel really bad for you. It took me one night. Or, conversely, your staffer reads it and says, the GOP sent this, we hate them, so vote no on the following things, and we'll just tell you all the bad things. You'll hear a lot of people from the left talking about this bill with the pre-existing condition waiver mentioned, without the $8 billion fund tied to it being mentioned whatsoever. Or you see the GOP talking about, of course all pre-existing conditions are covered. Point blank, it's in there. It's a mandate, you know? It's the law that they have to be covered for exactly the same price, without mentioning that the waiver system exists. So, I don't know. I hate both of them. But now you know what the real story is. I hope you enjoyed this, and I hope it wasn't boring. But if it was, nothing I can do. This whole thing is pretty boring. But it really does matter when it comes down to it. This is what will determine the healthcare system in our country. And the Republicans have it right now. They have the House, the Senate, and the presidency. So we'll just see what happens in the Senate, huh? Stay tuned. Like, really stay tuned. This is important. Especially if you live in one of those waiver states, because you might want to get out.